Jennifer, I'm going to cut to the chase. We have passports. Why don't we have certification of vaccination to make your life and professionals' lives easier?
Yeah, first of all, I think we should be doing everything possible to incentivize people to get vaccinated, and telling people that, just because you're protected with vaccines doesn't mean it's safe. I mean, that is counter, I think, to the goals of trying to get more people vaccinated. I think what it comes down to, and I'd be interested to hear what the secretary says about this, is how we actually establish vaccination proof. Probably has to be handled at the national level. Certainly those cards that you got filled out is probably not sufficient for international travel. But, the fact of the matter is, if you are vaccinated, you're protected, and we shouldn't require those people to quarantine upon arrival.
I look, Jennifer, at this moving target. When does this get fixed? John Farrell wants to know that. Maybe the Secretary of Transportation will help us. Do you see a timeline where this gets fixed rapidly, given the Delta variant?
No, and it's really tricky because, first of all, we know that there are deeply inequitable distribution of vaccines right now. So it does become a matter of international politics when basically just a handful of countries have used, more than 75% of the vaccines administered worldwide. We do also worry about the penalty that places on countries that very much want to vaccinate their public but haven't been able to get vaccines. And this would be yet another, I think, setback for them. That said, on the individual level, we shouldn't be telling people that they need to quarantine after they've already been vaccinated.
Jennifer, I'm trying to figure this out, and I know you are too. The Delta variant is now quickly becoming the dominant variant here in the United States. So what is the actual scientific rationale to still have these travel restrictions here in the United States?
Well, I mean, I think this comes down to the fact that not everybody who needs to be is vaccinated, and we're still very much dealing with that. That said, I think we do have to sort through the fact that we shouldn't be disincentivizing the people who already are vaccinated and telling them that it is a restriction for them. But we are going to see very likely, I mean, we're already seeing now about half of states reporting case increases. It's largely in states that have lower than average vaccination coverage, but not exclusively. And any state that has a pocket of susceptible individuals, as nearly every state does, could very well see case increases in the coming weeks. And so this is, I think, really a delicate time, and it really speaks to the urgency of getting as many people vaccinated as possible. And I've very long been a proponent of making the case for why vaccines change everything. And certainly when it comes to travel, it absolutely does.
You've referred to the incentives there. And just for a second, if we can just put the incentives to one side, I'm just interested in the science here as well, just purely the science, away from the behavioral science, away from the incentives. I want to understand, if a Delta variant is already prominent in this country, what's the use of shutting the border to people coming from the UK and coming from Europe? How does that help?
Yeah, well, I'm not a huge proponent of travel restrictions. I've never seen them change the epidemiology. I think at best they buy you a few weeks' time to get your act into gear. But if we looked at Australia, which has entered into lockdown, its largest city, Sydney, they had very strongly restricted travel, including not allowing their own citizens to come back if they had visited India because they were concerned about keeping the Delta variant out. That clearly didn't work despite those very aggressive efforts. So you won't hear me champion travel restrictions as the way to keep a virus from entering a country and to keep it from spreading, because clearly we have many, many examples where that simply has happened despite travel restrictions.
So
I think countries sometimes think that they'll gain a few weeks of time to prepare, maybe expand their surveillance, but unfortunately more often than not, they usually squander that time.
What about testing, though? I mean, where do we stand with regards to the pace of that? It seemed like that had been pulled back a little bit, and now, of course, with the emergence of the Delta variant, you're seeing at least some governments try to step up testing back to levels that maybe we saw during the height of the pandemic.
Yeah, so in the U.S., testing capacity has greatly eroded, and I'm deeply concerned about this. We saw around Thanksgiving testing basically start to level off, which was very confusing because the United States went into one of its biggest surges shortly after Thanksgiving. And what it really, I think, boiled down to was that states had to kind of pivot their attention to rolling out vaccines, and they could only do one thing or another. So it was really resources rather than epidemiology that was driving the pullback in testing. I used to get weekly text messages from my health department reminding me if I had symptoms to get tested. I don't get that now. I actually had to get tested not because I was sick, and it took me a really long time to figure out where to get tested. So this is really worrisome. We had spent a year building up a testing infrastructure that's now no longer there. And as we head into potential, surge of cases in multiple areas, we may not be as ready as we need to be.